Okay, so first of all, I'm going to get some gloves on, and then as part of your medical, we're going to first of all check the integrity of your skin on your face, on your neck, on your chest and your shoulders. Okay, so if you stay still for me, and you can close your eyes if you want to, but I'm just going to feel around your face for any lumps, bumps, or anything that might be seen as a little bit untoward. And this is also good for checking your facial symmetry as well. Yeah, everything is looking good. Okay, that's fine. I'm going to move down to your neck. So what I'd like you to do is, if you could lift your chin up just a tiny bit for me. That's fine, good. And I'm going to palpate the skin a little bit just to check the elasticity of your skin. I'll reach around the back. Okay. That is looking good. Okay, so I'm going to touch now your shoulders on either side. I'm just going to give them a little bit of a squeeze on either side. So, you ready? You feeling okay? Okay, just relax and you just squeeze your shoulders. Yes. Good. Okay, now if you can tense your shoulders up for me. Perfect. All right, that's fine. Let me just make one or two notes and I'll be with you in just 1 second. Okay, good. So far, so good. Let me just have a look at your arms now. So if you could roll your sleeves up just a little bit for me, that's fine. And if you can hold your arms out like this, and I'm just going to check the skin just along your arms. Yeah, good. If you turn your arm over for me. Yeah, that is perfect. Okay. Now, if you can spread your fingers out, just show me your nails. I just want to check if there's any flakiness or broken nails. Can be a sign of calcium deficiency, but no, those are looking good. All right, so we'll do your other arm now. So if you could hold your other arm out for me, that's fine, good. And let's just have a look at the underside of your arm. Yeah. Perfect. Okay, if you can turn your arm over now for me, and just going to have a look at the skin. And yeah, that's fine. If you can hold your fingers out for me, just so I can check your nails. Yeah, that is perfect. Good for you. Okay, let me just get that down. Okay, that's fine. So, next up, what we're going to do is I'm going to check your abdomen, and I'm going to do some palpations on your abdomen. So, what I'd like you to do is, if you could lift your shirt up for me. Yeah, that's fine. And I'm just going to have a feel, just a quick feel of the skin, just to check that there's no abnormalities. And it's fine. Now, the palpation tells me if there's any organs out of place or enlarged, or if there's any anything unusual going on inside your abdomen area. So what you're going to feel is this on your skin. So you can close your eyes and relax if you want to, but if you can lift your shirt up just a little bit, it's perfect. Good. All right. So, and I'm just going to have another quick feel around inside your shirt. Good. You okay? That's good. All right, I'm going to start palpating on the side. Okay, I'm going to move a little bit closer now. I hope you don't mind. Okay, if you can lift your arms up just a little bit more if you can, that's good. Perfect. You're doing very well. Okay, so what I'm going to do next is just going to press on your abdomen just a little bit, just to make absolutely sure that all the organs are all present and correct. I'm sure they are. So again, keep your shirt up for me, and I'm just going to press a little bit on some areas of your abdomen. So if you take a deep breath and let it out, that's good. Relax. Yes, good. We'll try the other side. Yes. That is perfect. Good, good. Just make a note. Okay. So far, so good. So, what we'll do next is we'll have a listen to your heart and see what's going on inside. Now, I'm going to use the stethoscope and I'm going to warm it up just a little bit because it can be a little bit cold to begin with. So, I hope you don't mind. Okay, if you can hold your hand out, I'll just show you. It's not too cold. So, okay, so again, if you can lift your shirt up for me, and I'm just going to have a quick listen to your heartbeat. Yeah, good. It's going to get in just a little bit closer now, so. Yeah. Okay, that's fine. So what I'm going to do next is I'm going to, your heartbeat, by the way, quite regular. Everything is fine there. All the fluid is, all the blood is flowing as it should do. So what we'll do next is just have a listen to your lungs. Now, what I want you to do is just to breathe normally to begin with. So if you just breathe normally for me, and I'm just going to have a listen to your lungs. And what this does is it tells me if there's any fluid on your lungs that we need to be worried about. So okay, if you breathe normally for me. Perfect. Good. Now, what I'd like you to do is if you could take a deep breath in for me, please. And out. Okay. Try that again. And take a deep breath in. And out. Perfect. Good. So, let me just have a listen around the back. So I'm going to move slightly this way. If you could lift your shirt up around your back. Yep, that's good. Thank you. And I'd like you to do the same again for me. If you could take just a normal breath for me. Just breathe normally. Good. All right, that's fine. Let's move across to the other side now. So, again, just breathe normally for me. Yes. Perfect. Now this time, if you can take a deep breath in and out. Okay. And we'll move across to the other side, so we'll do exactly the same again. If you can take a deep breath in and out. Yeah, perfect. Nothing untoward going on there. Everything is looking fine. So next, I'm just going to have a listen to your intestines, which sounds a little bit gross, but needs to be done. And this just tells me if there's if the fluids are working their way correctly through your intestinal system. Like I said, a bit gross, but you don't need to do anything with this. You just sit back and relax. And I'm just going to have a quick listen and see what's going on. Yeah, good. Mm-hmm. Okay. Okay, good. Mm-hmm. That is as perfect as it gets. So far so good. I'm just going to take a couple of notes. Yeah. So far, we're very fit and healthy. Okay, so just going to double check the percussion again. So if you can, if you want, you can close your eyes and just relax. And I'm going to palpate your chest area and then further on down your abdomen. So again, if you could lift your shirt up for me a little bit higher. Yeah, that's fine. Good. All right. So, and okay, good. Mm-hmm. Perfect. Yep. Couldn't be better. That's fine. So. Okay, so what we're going to do next is just going to check your heart rate, just to check that it isn't too fast or too slow. So if you could just hold out your arm for me. I'm going to put 2 fingers on your arm and I'm going to count from 15 just to count your pulse in. So if you could give me your arm. And okay, good. 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Yeah, that's fine. You've got a resting pulse rate of around 70, which is pretty good going, so that's fine. And what we'll do next is we'll just check your blood pressure. So I have this handy little gadget here inside this handy little case. Okay, so how this works is there's a little gauge here and a little pump. I'm going to pump this cuff, which is going to be around your arm, full of air, and then I'm going to let it go, and that's going to tell me what your blood pressure is like. So if you can hold out your left arm for me, please, and just undo this. Okay, good. That's fine, and we're just going to put it above the elbow. There you go. That's good. Is that comfortable? All right, that's good. It gets a bit tight, but it's not too uncomfortable. So, can have a look at this dial, and I'm just going to pump it full of air. Let's just adjust that slightly. There we go, that's better. Okay, start again. So, relax, take a deep breath. Okay, all right? That's fine. So, here we go. Mm-hmm. Okay. That's good, and I'm just going to let the air out. That is perfect blood pressure. 120/80, which is as good as it gets. So, just pop this back in the little case here. Oops. Okay, good. So, blood pressure is good, heart rate is good, cardiovascular system seems to be fine. So, next up, we're going to check your height. Now, we've already checked your weight in the other room, so what this will tell me is whether your BMI is within a healthy range. So, I'm going to use this tape measure here. Okay, so what I'd like you to do is, if you could, oops, if you could just stand on this for me, stand on the end of the metal tape, that's fine, and let's just see how tall you are. Yeah. Okay, good. Alright, so looking at your weight and your height, your BMI is well within normal limits, so that's looking good. And while we're here, as you've been such a good patient so far, I'm just going to check the width of your shoulders. Mm-hmm. Okay, it's going to check the side of your head from side to side. Mm-hmm. Perfect. And between your two eyes. Yep. All completely normal. Okay, so what we'll do next is we'll check how strong you are. So we're going to check your resistance. Now, what I'm going to do is I'm going to put my hands on either side of your face one at a time. And what I want you to do is I want you to turn your head against my hand, and I'm going to try and stop you, and I want you to try and fight me. Okay? So, do this side first. So, if you can turn your head into my hand, yeah, that's fine. If we can do the other side, turn it into my hand, fight it, fight it, fight it. Yeah, that's good. Now, I want you to lift your chin up a little bit. I'm just going to pop my hands underneath your chin. And what I want you to do is try and put your chin into your chest like that. And I'm going to try and stop you. So if you can put your chin down for me. Yep, fight it, fight it, fight it. Yep, that's good. All right. Do the same thing. I want you to lift your head up and back like this. And I'd like you to fight it, please. So on the count of 3, 1, 2, and 3. Fight it, fight it, fight it, fight it. Yeah, that's good. Okay, that's fine. Okay, so what we're going to do next is I'm going to put my hands out like this against your shoulders, and I want you to lean into them. Okay, and I want you to lean as hard as you can. Okay, so there we go, one on either side, and lean. Yeah, that's fine. I'm going to put my hands around the back of your shoulders now. And I want you to do the same again, but this time backwards. So on the count of 3, 1, 2, 3, lean back. Perfect. Yeah, that's fine. Okay, so now this time we're going to do much the same sort of thing, but this time leaning to either side. So I'm going to come around this side and I'm going to lean against your shoulder here. And I want you to push against my hand with your shoulder. Yeah, that's good. That is excellent. Okay, and we're going to do the same on the other side. So if you can lean against my hand with your shoulder. Yeah. Okay, that's good. Now, this time, if you can hold your hands out as though you're holding a board, about here, okay? And what I'm going to do is I'm going to try and push your hands down. Don't let me, okay? If you can keep your hands up as much as you can. So, on the count of 3, if you hold your hands out, 1, 2, 3, that's good. And I'm going to try and push that down. You are as strong as an ox. Well done. Okay. Alrighty, so just going to make some notes on how well you've done so far. Okay, so alright, so next up we're going to check your eyes. Now I'm going to use something called an ophthalmoscope, which is this little guy here. Now, for this test, I'm going to come in a little bit close, okay? So what I want you to do is to keep your eyes open for me, but if you can just keep your gaze as though you're looking straight ahead. Try not to mind me too much. So if you can look straight ahead, eyes open for me. Okay. If you can look up for me. Good. If you can look to your left for me. And to your right. And look down. Perfect. Good. We'll do the same with the other eye. So again, if you can look straight ahead from me, and if you can just keep your gaze as though you're looking straight ahead. Okay, so same thing. Check my lens is working, and if you can look straight ahead from me, we'll just check out your right eye. That's good. If you can look up for me and to your left, to your right. Perfect. And down. Yeah. Optic nerve and the fundus at the back of each eye is as healthy as can be. So far so good. Alrighty, so I'm just going to have a look at the outside of your eyes, and we'll check your pupil reflexes as well. So if you can look just to the bridge of my nose for me, and just going to have a quick look at your lids and your tear ducts. Okay. If you can look up for me. Perfect. If you look down, just lift your lid up a little bit. That's good. Straight ahead again for me. Okay, that's fine. All right, keep looking straight ahead again for me. Sorry, I've got to be so close. And if you can look up for me, it's going to pull down your lid. Okay, good. If you can look down for me. Yeah, perfect. That's fine. Alright, so this time if you can just keep looking at the bridge of my nose, and just going to check your pupil dilation. Yeah, good, that's fine. Okay, so next up, going to have a look at the back of your throat and inside your mouth. So if you can say ah for me, wide as you can, ah, and stick your tongue out as well. Just going to use this. This is a tongue depressor, just so I can see what's going on at the back of your throat. So 1, 2, 3, ah, tongue out. Yep, it's fine. Good. Okay, if you can say ah again. Perfect. No swelling, no inflammation, no redness, you're good to go. So. Okay, so what we're going to do next is we're going to change this up from an ophthalmoscope to something called an otoscope. Now what an otoscope does is lets me have a good look inside your ears to check if there's any blockages, any inflammation, anything untoward going on. So if you can turn your head a little bit this way, and I'm just going to have a look inside your ears. Sorry, it's a little bit cold. Okay, good. Yeah. All right, good. No blockages there, that's good. So if you turn your head a little bit this way for me, and we're going to do the same with the other side. And good, that's looking perfectly healthy. Yeah, that's good. Okay, now checking your hearing, this is a very, very basic test, but what I want you to do is if you can close your eyes for me like this, and what I'm going to do is I'm going to snap my fingers just very, very lightly, and you tell me which side that you hear the click on, okay? So, let's try it. Close your eyes. That's good. Relax. That's fine. And you tell me what side you hear the click. Yeah, good. Mm-hmm. Yeah. Uh-huh. Mm-hmm. Yeah, that's good. Now this time, keep your eyes shut, and what I'm going to do is I'm going to make a little bit of a noise on either side of your ears, and I'm going to bring my fingers further and further away. You tell me when you stop hearing my fingers rubbing together. Okay, so eyes shut. That's good. And yeah, good. Good hearing. That's fine. Okay. And just a couple more checks we need to do now. What I'm going to do with this little guy here is I'm just going to check your reflexes. So this one, I'm going to check your reflexes on your knees and on your ankles. So if you could just relax and sit back in your chair, and we'll try this left knee first. Yeah, good. Okay, and the right knee. Just try your ankles. So left ankle. Perfect. And right ankle. Yeah, that's good. Okay, so just make 1 or 2 notes, and I think just one more check we need to make. I just need to check your scalp, just to check for any redness or inflammation or flaky bits on your scalp. So if you can just turn your head down just slightly, that's good. And I'm just going to have a look at the condition. Okay, Okay, if you could just tilt your head downwards a little bit, and just going to check on the top and just around the back. Yeah. So, no redness, no flakiness, hair is in good condition. So, you are looking good. So, just finish up your notes, and you're looking a perfect specimen of health. Everything is good to go. So what we'll do is we'll send you some results in a couple of weeks or so, that you've got nothing to worry about. So, we'll see you again in 6 months' time. Good to see you again. Take care. Alright, so back for round 2. So what we're going to do next, how are you feeling? You okay? Alright, good. So what we're going to do next is we're just going to check the neck movements. So what I want you to do is, if you can relax in your seated position, and what I'd like you to do is, if you can lift your neck all the way up like that, just look up at the ceiling. Yeah, that is good. And if you can look down now to the floor. Okay, lift your chin up, and if you can look over to the side. Yeah, good. And to the other side for me. Yeah, perfect. Good. So what I'm going to do next is I'm just going to have a feel of the lymph nodes. So we're just going to pop my trusty gloves on again. Oops. These do not want to go on. There we go, good. Okay, so just going to have a feel of the lymph nodes. First of all, in the front and behind your ears. So just going to have a feel of the pre-auricular lymph nodes just in front of your ear. Okay, good. And let's have a feel of the post-auricular lymph nodes just behind your ear. Alright, yeah, that's good. If you can lift your chin up a little bit for me, just going to have a feel of the submandibular lymph nodes. Okay, and a little bit further down your neck. And I'm just going to feel now just along your collarbone. So if you can just unbutton the first couple of buttons there. Yeah, that's fine, good. So let's just have a feel there. Yeah. Yeah, that's fine, good. So far so good. Okay, so what I'm going to do next is I'm going to check the movement of your trachea at the front of your neck. So if I get you just to take a sip of water for me. Yeah, good. And if you can hold it in your mouth for me just for a second or two. And now if you can swallow for me. Yeah. Trachea nice and central, that's good. So we're just going to do the same thing again. Now if I can get you to take another sip of water for me. Okay, hold it in your mouth. And we're just going to check your thyroid this time. So I'm just going to press ever so lightly on this side of your neck. And if you can swallow for me. Yeah, perfect, good. Last sip of water, I promise. So if you can have a sip of water for me. Hold it in your mouth, and just going to apply A little bit of light pressure on the side of your neck. And if you can swallow for me. Yeah, that is perfect. Good. All right, that's fine. So, just going to have a look at your chest now. So if you can undo just another couple of buttons for me. Yeah, that's fine. I'm just going to have a feel of the skin first of all, just to check that everything is as it should be. Mm-hmm. Okay, good. And I'm just going to have a look now at the chest from this side. Check for any pulsations that we need to be worried about. So if you can keep looking straight ahead, and if you can take a deep breath for me. Mm-hmm. Yeah, that is good. All right, that's fine. Now, what I'm going to do next, I'm just going to reach around the back, and I'm going to have a feel of the spine, okay? So if you can keep looking straight ahead again for me. And I'm just going to have a feel of your spine. And just going to work my way down your back. Mm-hmm. No pain or tenderness, no. Okay, good. Uh-huh. All right, that is fine, good. Alrighty, so I'm just going to take my stethoscope now, and what we're going to do is we're going to listen to your heart and your lungs. First of all, we'll have a listen to your lungs. So I'm just going to reach around the back, and if you can keep looking straight ahead for me, and if you can take some deep breaths for me. Okay, so if you breathe in and out, breathe in and out, breathe in and out, breathe in and out. Good. Breathe in and out. Breathe in and out. Breathe in, nice big breath, and out. Okay, good. So I'm just going to check the other side now. So, same thing. If you can breathe in and out. 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 Okay, good. So I'm just going to move over to the side here. Just check the top lobe of your lung. So again, if you can breathe in, breathe out, breathe in and out. Let's just check the other side. Same thing. If you can breathe in and out. Breathe in and out. Perfect. Good. That's fine. So we've checked along your back. We're going to check now the front along the chest. So exactly the same thing, just checking the function of your lungs. So again, if I get you to keep looking straight ahead for me, I'm just going to pop this on the top part of your chest and take a deep breath if you can breathe in for me. And out. Okay, good. In and out. Good. Breathe in and out. breathe in and out. Breathe in and out. Okay, good. And breathe in and out. That's perfect, good. So we're going to have a listen to your heart now. So there are 4 areas of the heart that we need to listen to just to check that they're functioning properly. So you don't have to breathe so deeply this time. You'll be relieved to know. So if I get you to just relax for me, that's good. I'm just going to pop this on your chest. And aortic, good. Pulmonic, tricuspid, and mitral. Yeah, nice and strong. So you've got a good strong heart. Everything is okay. So that's good going. So let me just quickly make a note of that for you. How are you feeling? Everything is okay? Good. So far you have aced everything. Okay, good. So, next up, let's just check the lymph nodes under your arms. So what I'll get you to do is if you can lift this arm up for me. That's good. I'm just going to have sorry, it might be a little bit uncomfortable, but I'm just going to have a feel just underneath your armpit. Yeah. That's good. Clearly you're not ticklish, which is good. So if you can lift this arm up for me, and same again, I'm just going to pop my hand just into your armpit. Yeah, that's good. That's fine. While I'm here, I'm just going to check your carotid pulse on either side. So if you can take a deep breath for me and let it out and just kind of relax for me. I'm just going to pop my fingers on one side of your neck. That's good. And on the other side. Yep, both clear, strong, and even. So that's good. Okay, so let's just check for some pulsations on the side of your chest. Just kind of look at your chest from the side. So that's it. Keep looking straight ahead for me. Just relax. Yeah, that is good. And we'll just have a look at the other side. Yep, all present and correct. It's fine, good. So what I'm going to do next is if you can just unbutton the rest of your top for me, and I'm just going to have a listen to the stomach. So if I get you to relax again, I'm just going to pop this on your stomach. Yeah. Yep. Nice and active. That's good. So, let me just have a look now. Just going to push very, very lightly on your stomach. So, if I get you to relax for me and keep looking straight ahead, and I'm just going to push in very, very lightly just across your stomach. Okay, good. Now what I'm going to do next is I'm going to push a little bit harder this time. You tell me if you feel any discomfort or pain. So there you go. Good. Yeah. Okay, that's fine. So I'm going to feel now for your liver. So what I need to do, I'm just going to reach around your back and I'm just going to pop my hand along your back. Sorry if this is uncomfortable. I'm just going to push in a little bit on this side for you. Okie dokie. Yeah. That's fine. Good. And I'm just going to move across to the other side now. And we're going to feel for your spleen on this side. So I'm going to put my hand around your back again, and I'm going to push in ever so slightly. Yeah, that's good. Yeah, don't feel anything there. You shouldn't feel anything really when you're looking for the spleen, so you wouldn't want to find anything. But that's perfectly okay. So put that down for you. Yeah. All right, that's good. So, next part of the test, we're going to check out your legs. So if you, in the sitting position, what I'm going to check first. Now, I'm going to check the top of your thighs. This might be a little bit uncomfortable for you, but this checks the femoral pulse, and we're going to do that on either side. So I'm just going to pop my hand just underneath your shorts. I'm sorry if it's a little bit uncomfortable. And I'm just going to feel on the one side for your femoral pulse. Yeah, that's nice and strong. And on the other side, same thing. Yeah. Perfect. Good. And we'll feel for your inguinal nodes at the same time. Yeah, that's fine. Good. So what I'm going to do next is I'm going to feel your legs from the top down on either side, just to check the muscles and the joints, etc. So I'm just going to feel your hips on either side. No pain or tenderness, no. Okay, good. And I'm just going to feel your right-hand side leg. I'm just going to feel the thigh muscles and your knee joint. Yeah, that's good. All right, if you can lift your leg out for me, yeah, that's fine. And we'll just feel your lower leg. That's fine. And we'll just feel your feet. Okay, so we're going to do exactly the same on the other side. I'm just going to feel your thigh. Good. And your knee joint. Yeah, good. And let's just have a look at the lower leg. Yeah, good. Just check out your feet. Good. All right, that's good. So if you can keep your feet sticking out for me, we'll just check the pulse on the underside of your foot. And the other side. Yeah, perfect. Nice and strong. That's good. Alrighty. So what we'll check next is the function of your legs. One at a time, what we'll do is, if I can get you to, in the sitting position, just lift your knees to your chest. So we'll start on this side. If you can just lift your knee up for me. Good. Yeah, that's fine. We'll do the same with the other side. If you can lift your knee up for me. Yeah, perfect. Good. All right, so you can put both your legs down now. All right, so let's just have a look at the function of your feet. So what I want you to do is to, if you can point your toes down for me, down to the floor. Good. If you can point them up to the ceiling. Yeah, good. Okay, and if you can point them both out this way. And point them both in at each other. Yeah, that is perfect. Good for you. All right, that's fine. So what we're going to do next is we're going to check some reflexes with this little guy here. So we'll check the reflexes in your arms first. So what I'll get you to do, one at a time, we're going to do your arms. If I can get you to put your one arm this side up like this for me, and Good, that's fine. And if you can turn your arm palm up like this for me. Good, that's fine. So we're going to do the same with the other arm. If you can lift it up like this for me. And now palm up like this. Just relax. Okay, we'll try that again. Perfect, good. So we're just going to try your knees this time. So we'll just do this knee first. Good. And the other side. Okay, perfect, good. So just check the reflexes in your ankles this time. So if I get you to just keep looking, keep relaxed for me. Good. Same on this side. Okay, that's excellent. Okay, you've done very well. Okay, so next up what I'm going to do is I'm just going to percuss the stomach area. So if you can just relax for me and perfect. Just going to move across, so let's do it on this side. That could not be better. Okay, good. Now if I get you to stand up for me, perfect, and if you can just relax like this, and what I want you to do is this time I want you to bend forward and touch your toes for me if you can. And what I'm doing now is I'm just checking the curvature of your spine. So yeah, that is perfect, good. And if you can stand up again for me, perfect, good. And this time if you can bend back just a little bit for me. Yeah, that is fine. And if you can right yourself up. Now what I want you to do next is if you can stand to attention like this. And what we're going to do is I'm going to get you to just keep your hands, palms on your thighs like this. Perfect, good. And I want you to slide down. Okay, keeping your hand on your thigh. Good. All right, you can come back up now. I'm going to do the same on the other side. So if you can slide down for me. Yeah, that is perfect. Good for you. All right, so let's just pop that down for you. So you are good to go. Just one more check we need to do next. We just need to check your BP, your blood pressure. So what we'll do is I'm just going to pop this cuff on your one arm. So there you go. If you can sit back down again for me. Perfect. And I'm just going to pop this cuff on for you. Okay, good. That isn't too tight? No? Okay, good. So I'm just going to pop this, fill this up with air. Okay, good. And Fine colours. That's great. It's good to meet you. And what we'll do is we'll see you again in 6 months' time. Any problems between now and then, of course, just pop back in. Good to see you again. Bye-bye. What we're going to do today is we're going to give you a full medical from head to toe. We're going to start off with your hands. We're going to move all the way up to your head. And we're going to have a look at your head, right the way down to your body, right the way down to your feet. So let's get started. What we're going to do first is to have a look at your hands. So if you could just hold out your hands for me, and if you can put them face down, and I'm just going to have a look at the nails and the skin. Okay, yeah, that's looking good. If you can turn them palm up for me, please. Yeah, that's fine. And turn them palm down again for me. And what I'm going to do is I'm just going to squeeze your fingers on each hand, okay? So, okay, now you tell me if there's any pain or discomfort. Is that okay? Okay, good. So we're going to move across now to your other hand. If you can hold that out for me. And we'll just squeeze your fingers. Yeah, no pain or discomfort. No. Okie doke. All right, that's good. So I'm just going to feel up your arms. So if you can hold your arms out for me again, palms down. And what I'm going to do is feel the muscles just to check there's nothing untoward. Yeah, it's good. Nice strong muscles. Let's have a look at your other side. Okay, feeling your forearm and your elbow. Okay, good. Bicep. Okay. Yeah, that's fine. Good. Okay, so I'm just going to feel the edge of your shoulders. So if you relax for me, that's fine. Just relax. Okay. Yeah, that's good. Okay, so let's have a look now just at your head. Now I'm going to check for symmetry of your physical features, and we're going to check your scalp as well. So let's just have a look at you, and everything seems symmetrical. Let's just have a quick feel around. Okay, good. And if you can lower your head for me a little bit, and we'll have a look just at your scalp, just to check the skin isn't broken or red or flaky. Just have a look around the back of your head. Yeah. Perfect. Okay, good. All right, if you can look straight ahead for me, I'm just going to have a look at the hairline along the top there. Okay, good. Yeah, skin is looking perfect. So far, so good. Let me just make a note of that for you. Okay, so what we're going to do next, we're going to check the strength of your arms, of your upper body. So what I want you to do is, if you can hold your hands out for me like this, palms down. I want you to put your palms into my palms, and I want you to push down for me. Yeah. Okay, nice and strong. And if you put your arms out this way with your palms down again, and push down for me. Okay. And palms up this time, and I want you to push up. Okay, that's fine. Now, if you keep your arms to your side for me, that's fine. Now, what I want you to do is have your palms towards your thighs, so your palms are facing inwards. And what I want you to do on this side, I want you to move your arm outwards, and I'm just going to try and stop you. Yeah. That is perfect. And we'll have a look at the other side as well. We're going to do exactly the same thing on the other side. So if you can do the same thing, if you can move your arm outwards, and I'm going to try and stop you. Fight it for me, fight it for me. Yeah, perfect. Okay, so far so good. Okay, so what we're going to do next is we're just going to check the ears. So I'm just going to have a feel, first of all, on either side of your head, just to check there's no breaks in the cartilage or the bony areas. Okay, we'll have a look on this side first of all. That's fine. And we'll have a look on the other side now too. Alright, that's good. And what I'm going to do is I'm going to check your hearing. Now I'm going to say a letter and a couple of numbers on each side, and I want you to tell me what the letter and the numbers are. I want you to repeat them back for me. Okay, so you think you can do that? That's fine. So I'm going to, if you can close your eyes for me, we'll start on your right hand side first. So if you can tell me what letters and numbers that I tell you. 5, B, 16. Can you repeat that? Yeah, that's fine. Close your eyes again, and other side. 14. P. 22. Can you repeat that back to me? Now that's good. Just try this one side again. 17. Z. 42. Repeat that back. Yeah, brilliant, good. Okay, and close your eyes again for me, and the other side. Okay, 15. D. 50. Yeah, perfect. That's fine. So, what we'll do next is we'll have a look inside your ears. Now, we're going to use something, called an otoscope, which is this little guy here. So we're going to have a look down your ear canal. So if you can turn your head a little bit this way for me, that is perfect. And what we are looking for here is we're just checking if there's any swelling or redness in the ear canal. And we're also checking the tympanic membrane, just to check that everything is A-OK. Yeah, that is looking good. Okay, that's fine. That's one ear done. So if you can turn your head a little bit this way, so you're looking over there for me. And just tilt your head to the one side for me. That is perfect. Good. Just gives me a little bit more access. And just again, looking, just checking the canal for any swelling or redness. And again, we're just checking the tympanic membrane, just to see whether there's any problems or potential problems, but that is looking as sound as could be. Okay, that is brilliant. Good. That's fine. So far, so good. So what I want you to do next is, if you can close your eyes for me. We've checked the hearing once, but just to be absolutely sure, I want you to close your eyes, and I'm going to click my fingers on one side of your head, and you tell me which side you hear the clicking. Okay? So if you can shut your eyes for me, and that's it, just relax, and tell me where you hear the click. Good. And again. Perfect. And now. Okay, good. And again. It's fine. Once more. Yeah, that's fine. Good. All right. So, what we'll do next is we'll just have a look at your eyes, but I'm just going to write just a couple of notes to where we are so far. Okay, you're doing very, very well. And just one more thing with your ears. I'm just going to check. I'm just going to pull on the end of your ears just to check that they're on your head properly. Yeah, I'm just kidding. No, they're fine. Okay, so we're going to have a look next at your eyes. So, what we're going to do first is we're going to check the pupillary reflex, just to check that the pupils are constricting and getting wider as they should do. Now, there's something called direct and consensual. When I shine the light in one side of your eyes, the other pupils should constrict at the same time as the one I'm shining the light into. So I'm just going to pop my hand just here, and we're just going to check direct, consensual. Just check that again for you. Direct, consensual. Yeah. Once more on this side. Direct and consensual. Perfect. Good. All right, we'll try the other side. And direct, consensual. Direct, consensual. Okay, once more. Direct and consensual. That's fine. Good. So, we shall do now the swinging light test. So I'm just going to swing the light from pupil to pupil. So if you can keep looking straight ahead towards me and your head straight, that is fine. Good. And keep looking straight ahead. Just going to take it from side to side. Yeah. That is fine. Good. So, no relative afferent pupil defect there. That is looking good. So just get that down for you. All right. So far, so good. Okay, so what we're going to do next is what I forgot to do at the beginning when I was checking your hands. I forgot to check your pulse. So if you can hold your hand out for me, please hold your wrist out rather. And I'm just going to place my 2 fingers on your pulse, on your wrist, just to check the pulse rate. Got a nice strong pulse there. Just wait for around 15 seconds. Yeah. Good. Good. Yeah, that is fine. Totally normal pulse. You're obviously quite relaxed. So, what we'll do next is, if I get you to keep looking straight ahead at me, and again, this is to do with your eyes. What I want you to do is we're just going to track the light. So, if you can keep your head still, that's right. And when you follow the light, don't move your head. If you can keep your head absolutely still for me. So, keep looking at the light for me and just follow the light with your eyes. good. Perfect. Perfect. Just going to move it diagonally now. Yeah, good. Okay, perfect. If you could follow the light up again for me. And down. And to the side. Good, 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 good. And to the other side. Perfect. Mm-hmm. 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 Yeah. Your eyes are tracking exactly as they should be. So far so good. Just going to check the integrity of your brows. So if you can keep looking straight ahead again for me. Just going to feel along the top of your brow bone on either side. Mm-hmm. Okay, let's just have a closer look at that for you. Yeah. Mm-hmm. Okie doke. That is perfect. Good for you. Alright, so what we're going to do next is we're going to change this up for the ophthalmoscope. There we go. And this time I'm going to have a look inside your eyes. We've had a good look around on the outside of your eyes, and we check the tracking, etc. Your outside of your eyes and your muscle action is perfect. So we're going to have a look inside your eyes just to check what's going on. So I'll have a look at this eye first. Now, if you can look straight ahead for me and look at just your point of gaze at some point in the distance there. Okay, so, and just going to shine this light in your eyes. And what we're doing is we're looking from the front of the eye right the way through the middle, through the lens and the anterior chamber, right through to the posterior chamber, right the way to the retina at the back, and checking that everything is as it should be. Yeah. Okay. Alright, if you can look up to the ceiling for me. And if you can look to your left. Perfect. Do you want to blink? Okay, good. And if you can look now to your right. Mm-hmm. If you can look down to the floor for me, I'm just going to lift your lid up a little bit. Mm-hmm. Look straight ahead again for me. And again, if you can look into my light. Mm-hmm. Yeah. Perfect. Good. All right, let's have a look at your other eye. So again, if you can look straight ahead for me. And again, it's a little bit bright. I'm sorry about that, but it's not going to last for too long. So if you can look straight ahead for me. Okay, good. And if you can look up to the ceiling for me. And down. Just lift up your lid, so keep looking down to me. Mm-hmm. Okay, good. If you can look to your left. And to your right. And look into my light. Yeah? Perfect. Good. So far, so good. All right, so let's see where we are up to. And I'm just going to make another couple of notes. Okay, so you're doing good. So what we're going to do next is we're just going to have a look at your nose. So no problems with smell or anything, no changes in your sense of smell. No, when you walk into a coffee shop, for example, you can smell the coffee? Yeah? Okay, that's good. So what I want you to do, it's going to be a little bit uncomfortable, sorry about this, but I need you to lift your chin up just a little bit for me. And I'm just going to shine this up your nose, so just to see what's going on. And again, we're looking for any redness or swelling or any drainage issues. Okay, good. All right, so keep your head up a little bit for me, just that's fine. Okay. Yeah. Perfect. Okay, so no issues with your nose. So what we'll do next is we're going to have a look inside your mouth. Now, what I need to do is just to pop some gloves on for this bit. There we go. So what I'm going to do is I'm just going to pop this inside your mouth, and I'm just going to have a look around for any abnormalities. So if you can open your mouth for me, and if you can say, put your tongue out like that, just go, ah, yeah, that's good. And let's just have a look, see what's going on here. If you can say ah again for me. Yeah. Alright, that's good. Okay, perfect. Let's just have a look at the roof of your mouth. And alright, now this time if you can lift your tongue up for me. There you go, I'm just going to scoot this underneath. Yeah, good. Alright, that's fine. Now if you can stick your tongue out again for me, like that. And I'm just going to have a feel of your tongue on either side. And we're just going to feel the integrity of your tongue, no lumps or anything. No, that's fine. And I'm just going to pop this inside your mouth. So if you can open wide for me, and we'll just check the insides of your cheek. Just check that they're nice and smooth. Yeah, perfect, good. All right, and the other side, do you want a breather? Okay, all right, just have a swallow. And again, open your mouth for me. Let's have a look at the other side. Okay, perfect. A little bit uncomfortable. Sorry about that. Okay, so what I want you to do next is let's just make a note, and we'll just check that your jaw muscles are working well. So no issues with eating or anything. Chewing is okay. Yeah. And when you open your mouth wide, there's no clicking or anything. No. All right, that's good. So what I want you to do, I'm going to put my hands on either side of just below your ears. And what I want you to do is to clench your jaw for me. Like that, good. All right, that's fine. And now what I want you to do is to open your jaw like this for me. Yeah, good. And now close your jaw for me. All right, that's very good. That's fine. Okay, so what we'll do next, and this is the part of the test that I love. So what I want you to do next is we're going to pull some funny faces, and this just tells me that your facial muscles are working well. So what I want you to do first is to smile. like this. Okay, show your teeth. Perfect. If you can frown for me, like that. Yeah, good, good, good. All right, if you can raise your arms, raise your eyebrows rather, as if you're surprised. So, like this. Yeah, perfect, good. If you can puff out your cheeks for me. Yeah, that's very, very good. And what I'm going to do next is, what I want you to do is if you can turn your head and look over there for me. I'm going to put my hand on the side of your face like this. Now, what I want you to do is to push against it. Yeah, that's fine. I'm going to do the same thing on the other side. If you can look over there for me, and if you can, I'll put my hand on the side of your face. If you can push against it for me. Yeah, that's good. All right, so far, so good. So, you have done very, very well with the first part of the test. And you might want to just rest your eyes for a little bit, and then we'll have you back for the second part of the test later on. Okay, see you later. Alright, so we're going to be examining your eyes today. So first of all, what I'll get you to do is, if I get you to look straight ahead for me, we're going to do something called a cover test to begin with. Now, this checks the muscle balance of your eyes and tells me if there's any squints or anything going on with the muscles that control your eyes. So what I want you to do is to look at a spot just about here for me. Okay, keep looking straight ahead, and I'm just going to cover up your one eye. Yes, good. All right, keep looking straight ahead for me. Just do your other eye. Yes. Excelente. Perfect. We just cover one eye at a time. Yes. Pretty good going. Okay, if you can look at the bridge of my nose, please, just here. Okay. We're just going to do that again for near vision. Perfect. Yeah, that's good. All right, so I'm going to take a closer look at your eyes now. I'm going to be shining this pen torch into your eyes just to check the basic integrity of your eyes, looking at it from the outside. So if you can keep looking straight ahead towards me, and if you look at the bridge of my nose again, and I'm going to come in just a little bit close. I hope you don't mind. Good. That's fine. Okay, perfect. And if you keep looking straight ahead again for me. Got nice big eyes, really easy to examine. That's good. Perfect. So we're going to do something called a swing test next. Now, this checks that your eye pupils are dilating pretty much the same on each eye, because otherwise it can suggest a neurological problem. So if you can look again just at the bridge of my nose, you're doing really well. And I'm just going to swing the light to and fro, from one to the other. Yeah, good. And if you look straight ahead again for me. Perfect. and your eyes are dilating exactly as they should. Yeah. That is perfect. I'm just going to have a look at your lids now. So, if you can look up to the ceiling for me, I'm just going to lower your lid, have a look at your tear film, just to see what's going on. Okay, good. If you can look down for me now, I'm just going to lift up your lid. Sorry, it's a little bit uncomfortable. Yeah, good. That is fine. Perfect. I'm going to do the same now with the other eyes. So if you can look up to the ceiling for me, I'm just going to pull your lid down. Yes. Healthy as can be. And if you look down again for me, you're doing really well. Okay. Yeah. That is absolutely perfect. Okie doke. So far, so good. So no problems with your eyes. You can see okay. You don't wear glasses or contacts or anything, no? Yep. Okay. All right, that's fine. No itchiness. It's hay fever season, so you haven't been suffering any symptoms. No. No, that's good. Okay. So what we're going to do next is I'm just going to get you to look at the very tip of my pen, just here, okay? Now, this tells me whether your eyes converge properly. So, if you keep looking at the bridge of my nose to begin with, yeah, perfect. And now, if you could look just at the very tip of the pen, I'm going to bring it in closer, closer, closer. Keep looking, keep looking, keep looking. Yeah, that's good. All right, we'll do that once more. If you keep looking at the tip of the pen for me, keep looking, keep looking, keep looking, keep looking, keep looking, keep looking. That's fine. Good. Okay. All right, so what I'm going to get you to do next, I'm going to check how your muscles work that move your eyes up, down, right, left, and diagonally. So I'll get you to look for me at the light at the end of the torch. And I want you to keep your head still. That's it. That's good. Keep your head still. And if you can follow the light with your eyes, just your eyes, okay? Don't move your head. So keep looking at the light for me. Yeah, good. Perfect. Keep looking at the light for me. Try not to break your gaze. You're doing really well. Okay, that is excellent. Just do up and down once more for me. Okay, now what I want you to do next is I'm going to keep the light on and I want you to fix your gaze on the light, but this time you're not going to keep your head still. You're going to move your head up, down, right and left. So if you could move your head up for me, keep your gaze on the light. Up again. Perfect. And if you can look down for me, keep your eyes on the light. All right, if you can move your head this way for me, keeping your eyes on the light as much as you can. Yeah, that is good. And if you can look that way for me, Keep your eyes on the light. Yeah. So far, so good. Okay. So, what I'm going to get you to do next is if you can cover up this eye for me, cover up your left eye, and we're going to get you to read some of these letters for me. So, if you can start from the top and work your way down to the green line. Can you see this green line just here? Okay. So, if you can start reading the letters for me. Yes. Good, good. All right, can you read that line just above the green line? Yeah, that is perfect. That is 20/20 vision. So, let's just have a look-see. Okay, now what we're going to do next is we're going to check your color vision. So, what we have here is a circle with a number in the middle. Can you tell me what the number is? Yeah, that's good. Okay, just try a couple more. Right, can you tell me what this number is here? Yes, good. Okay, perfect. And can you tell me this number here? Yeah. Okay, that is fine. Now, let's see if I can get you to tell me this number here. Yeah, perfect. Got good color vision so far. Now, can you tell me this number here? No? Aha, tried to trick you. Yeah, there's no number in there. So you're good to go. All right, that's fine. Okay, so your color vision is pretty much perfect. Okay, so what have we got next? You don't need glasses, that's for sure. Your vision's very, very good. You're getting 20/20 vision. And your color vision is perfect. So one last thing, I've had a look outside your eyes. I need to check inside your eyes now. Check the retina, the lens, the periphery of your retina, just to check that everything is as it should be. So we're going to do one eye at a time. So if I get you to keep looking ahead again for me. Now this light is going to be, because I'm coming closer, it's going to be a little bit brighter than the other light. So sorry about that, I hope you don't mind. But if you can keep looking straight ahead, and if you can fix your gaze round about here for me, that would be perfect. So keep looking straight ahead for me. That's good. Right, so now if you could look up to the ceiling for me. Great. If you can look this way, over to your eyes. Okay, if you can look down for me, please. And I'm just going to lift your lid up again. Okay, good. And just finishing up with your eyes. Yeah. Okay, good. The inside of your eyes, the macula, the retina, peripheral retina, mid-retina, everything is looking nice and healthy. Optic disc is nice and healthy. No sign of glaucoma or anything nasty like that. That's cool. All right, so if you can keep looking at the light for me, and if you follow it out, and follow it in and follow it out and follow it in. Yeah, perfect. That is good. You don't need glasses, that's for sure. Your vision is very good and your eyes look nice and healthy. Now, because we do a complete service here, what I'm going to do is I'm just going to trim your eyebrows because they need to be on point. So if I get you to just keep looking again straight ahead, and let's just give those a little bit of a trim. Yeah. Eyebrows on point. So that is you done and dusted. Good to see you again, and we'll see you again soon. Bye-bye. So let's get right into it. Now, first of all, what we need to do is we just need to check your facial symmetry and check that everything is no lumps, bumps, or anything unusual going on around your face. No, everything seems to be a-okay. So that's cool. Can you open your jaw for me, please? Thank you. And now clench your teeth. That is so cool. Okay, thank you. How long has it been since the accident? So it's been a few months, yeah? And how have you been sleeping since the accident? On and off. Okay, all right, that's fine. So what we will do to begin with is we'll just check your field of vision, because a knock to the head can sometimes mess with your field of view. So what I'd like you to do is I'd like you to look right at my nose, just here, and I'm going to bring my fingers out into the outer bit of your field of vision. What I want you to do is tell me when you notice a finger coming into your field of view. Okay? You think you can do that? All right, that's good. So if you sit back in your chair for me and sit as upright as you can without being, too uncomfortable. Look at the bridge of my nose and tell me when you see a finger come into your field of view. Yep, good. Okay. Cool. Yeah, that's fine. Keep looking just here. Bridge of my nose. Okay. Yeah, good. Fine. Okay, good. Just try that again. Perfect. Okay, keep looking just here for me. That's so cool. Thank you. All right, that's fine. Okay, no problems with your field of view so far. So what I want you to do now is just to check your facial muscles. I need you to make some, this is going to sound weird, but I want you to make some silly faces for me. Okay? Now, if you just follow me, and if you can, first of all, just scrunch your eyes up like this for me. Okay? Nice and tight. Yeah? Yeah, that's fine. Now, if you open your mouth as wide as you can. Yeah, cool. That's fine. If you look surprised, if you can wrinkle your forehead for me, make wrinkles. Yeah, that's good. If you can stick your tongue out for me, like that. Yeah, yeah, that's fine. Okay. And if you can clench your teeth, like this. Yeah. Perfect. All right, you can unclench now if you like. So far, so good. That's fine. Now, what I want you to do next is if you can turn your head this way for me. Yeah, that's fine. Turn it the other way. That's fine. If you can look up for me. Yeah, and down. Yeah, so far, so good. That is excellent work so far. All right, so what we're going to do next is we're going to just check your hearing. So what I want you to do is to close your eyes, and what I'm going to do is I'm going to make some soft noises from right in your right ear and in your left ear, and you tell me where the noise is coming from. Okay? All right, so shut your eyes. That's fine. Yeah, good. Yeah, that's fine. Okay, cool. All right, that's fine. Good, good. Now, if you can open your eyes now. All right, that's good. And if you keep looking this time straight at me, and what I want you to do next is if you can tell me when the noise disappears. Okay, so you'll be hearing a noise in your ears. If you can tell me when it goes away. Yeah, that's fine. Good. All right, excellent. That's fine. Okay. Now, what I want you to do next is just checking from the shoulders up. What I want you to do is to pull your shoulders up as far as you can for me. Okay, good. And now let go. Yeah, that's fine. And if you can raise one shoulder up, this one here. Yeah, good. And the other shoulder for me. Yeah, that's fine. Doing good. Okay. Now, next up, what we're going to do is touch nose, touch finger. Now, what I want you to do is to take your finger, touch your nose for me. Yeah, that's fine. Now, what I'm going to do is I'm going to bring my finger up, and what I want you to do is to touch your nose first, and then touch my finger wherever it may be, okay? Because I'm going to move it around. I'm going to try and trick you. So, if you touch your nose, touch finger, touch 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 nose, touch finger. That is brilliant. Yeah, well done. So, now, what I want you to do next is if you can close your eyes for me. And what I'm going to do is I'm going to put this torch, this flashlight, the cold metal of it up to your face. And I want you to tell me where you feel the cold metal. Okay? So, yeah, that's good. That's fine. Yeah, that's brilliant. Good. Perfect. Perfect. Yeah, excellent. Last one. On your nose. Yeah, that's good. Okay, so what we will do next is, what I'm going to do is I'm going to touch your face again, and I'd like you to tell me, you see this this pen, it's got a sharper edge and a duller edge. I want you to tell me whether you feel a sharp sensation on your face or a duller sensation. So if you hold your hand out, let me just show you the difference. There you go. That's the dull end, and that's the sharp end. So it's not really very sharp, but you know what I'm saying. So, okay, close your eyes. Perfect. And sharp or dull? Yeah, good. Sharp or dull? That's fine. Sharp or dull? Yeah, good. Sharp or dull? Yeah, perfect. Yeah, you're doing so well. Sharp or dull? Perfect. That's great. Okay, so check your eyes next. Check that your ocular nerve is working well. So we're going to, first of all, just check the your dilation. So I want you to look straight at me again, okay? And it's going to shine a light in your eyes just for a second or two. Yeah, good. Okay. Perfect. Now what I want you to do next is if you could hold your hand like this on the bridge of your nose for me. Can you do that? All right, that's good. Now we're going to do what's called the swing test. And I'm just going to swing the light from back to forth and see whether or not your pupils dilate as they should. Okay, so if you look at the bridge of my nose again for me and put your hand up like this, that's perfect, good. All right, so keep looking. Yeah. Yeah, that's fine. You're doing good. And take your hand down now. Alrighty, so let's just check what you can see. Now, if you cover up one eye for me, if you cover up your left eye, I'm going to point to some letters, and you can tell me what letters you can see. If you start at the top and work your way down, so. Yeah, keep going. Yeah, 20/20 in that eye. If you cover the other eye for me, and same again. Yeah, that is as perfect as it gets. And you don't wear contacts or glasses or anything, no? Oh, that's great. That's good. Alrighty, so we've done that. We've done that. Let me just check the way your eyes follow the light. So if I get you to keep your head nice and still, and if you can look directly just at the bridge of my nose to begin with, see the light. Now I want you to keep your head still, just with your eyes, if you can follow the light for me. Okay? So if you start off here and then follow the light for me. Yeah, that's so good. Yeah, keep following the light. Try not to move your head. If you just keep looking at the light for me. Alrighty. Yeah, that's great. Good. Perfect. And I'm just going to have a closer look at your eyes again. So if you can look, if you kind of look just past me, just over here somewhere, I'm just going to have a closer look just at around the eye's orbit. And okay, good. You've got nice blue eyes. Okay, keep looking straight ahead for me, please. That's great. Alright, keep looking straight ahead. You're doing very well. Okay, good. Okay. Keep looking just beyond me. Yeah. Mm-hmm. Nice, very healthy eyes. Yeah, you're looking good. That's fine. So we've just got one test left, and this tests your olfactory nerve, which is your sense of smell. So I'm going to give you some things to smell. If you can close your eyes for me, they're all pretty recognizable smells, so you should be able to tell me straight off the bat what you think they may be. So, keeping your eyes shut, and if you can tell me what this is. Yeah, citrus. Yeah, that's good. Okay. And what's this? Chocolate. Good. You're good at this. That's fine. And what's this? Yeah, vanilla. Not many people get that. That's excellent. Well done. All right, one last one. And what do you think this may be? Strawberry. Excellent. That's great. Okay, so 10 out of 10 so far. You've done really well. So one last check. I'm just going to just check your scalp again from where you had the bump. So I'm just going to check your scalp to feel any lumps or bumps or anything unusual going on. Okay, good. Yeah, and just going to feel around the back of your head. So if you just relax, that's good. That's fine. Okay, good. That's great. Yeah. Absolutely nothing wrong with you as far as your cranial nerves are concerned. You did really well, and you've recovered really well from the accident that you had a few months back. Everything is working. Have you back in 6 months' time just to see how you're getting on. So good to meet you again. Good to see you, and we'll see you again in 6 months' time. Okay, take care.